Good morning, everybody. I am Matteo Tretti Clementoni. I'm a plastic surgeon. I live and I work in Milan, that is in the north part of Italy. If I have to use two words on what I like most on the system, these two words are no downtime and very good results. At the beginning, I had serious doubts about the effectiveness of the device, but then very quickly I started to see my patients very happy, and so I was very happy too. Technology is based on the microneedling radio frequency. The needles are the anode and the plate is the cathode. Thanking the heat is not a mechanical force. The heat will generate dermis coagulation. I'm thinking about patients from 20 to 40, 45 years old. Is much easier to treat women than men because the thickness of the skin of women is lower than men, or better, we can obtain better results on women compared to men. Or again, we have to do more sessions of treatments on men to arrive at the same results we are able to obtain on women. The millennials, the rejuvenation for, again, patients from 20 to 40 that want to prevent the ptosis of soft tissues and can have an improvement of the appearance of the face. Because I'm living in the north part of Italy, it's not easy for us to have dark skin patients, so we have more patients of skin type 2 to 3. So I have no great experience on dark skin patients, means skin type 5 to 6. But I never had any kind of PIH of hyperpigmentation after the procedure, so I do not think you can see any problem. Naturally, considering maybe a patient coming from India, Pakistan, Asia, or Africa, or Afro-American patients, I think you have to reduce the energy and the pulse duration. That means reducing the coagulation, the inflammation effect, and so reducing the risk eventually to have PIH. Patients really doesn't feel nothing or better. We have to modulate the procedure following what the patient is feeling during the procedure. I put some settings on the device, and then if the patient is feeling a minimal amount of pain, you can reduce just a little the energy and the pulse duration, and so it's a very, very extremely acceptable procedure. I never use numbing cream, also because the numbing cream can increase the amount of water inside the skin. So I absolutely prefer to clean the skin and do directly the procedure. They define the procedure as absolutely acceptable. A minimal heat or better, they report like a warm feeling of the full area, not lasting a lot, few minutes. Many of my patients are coming during the lunch break. So they are working in the morning, they are coming, they are doing the procedure that is very, very fast, and then they are going back to work after the lunch break. So they have no unpleasant feeling during and immediately after. I suggest my patients to do at least 3 to 4 sessions. Naturally, more severe is the defect, higher would be the number of sessions. Each procedure is creating inflammation in the skin, and I would like to leave some time between sessions because inflammation will give us collagen production. So I think that the right distance between sessions is around 3 to 4 weeks. I say to my patients that they will start the results of the first session when they will do the second. So at least they have to wait 1 month. But I also explain my patients that they have to wait time because collagen needs time to be produced, and so they cannot expect results 2 minutes later or better. They have a minimal swelling after the procedure, so 1 hour after they are happy. But this is not the final results. To appreciate the real final results, they have to wait at least months. But this is also important because at the end of the sessions, to have a complete results, they can have to wait at least again 2 to 3 months. So they are continuing, they are improving month by month. And so 3 months later, they are much better than 1 month later. If we have to speak about lasting of the results, is a very good question. The second after the procedure, the aging process continues to be there. So soft tissues will go down, we will have fat and bone reabsorption, everything. On rejuvenation, I think that the patient have to do 1 to 2 sessions every year and a half to keep the results obtained with the first sessions we performed. Because there's no pain or minimal pain, there's no downtime. They do not have to stay outside their social life for a long time. Is coming here, staying here 10 to 20 to 30 minutes and go back to their normal life. So it's not a procedure that require a recovery time, no social life, no restaurants, no theaters, no work. They can do that without problem, so they're happy to do that. I think that the system has 3 main advantages. One is good results. The second is no downtime. And the third one is no preparation. That means no numbing cream, and so very quick and fast procedure. I really like to combine this procedure with the other technique or devices, not in the same session, but I like to use fractional CO2 on acne scar patients and other devices, maybe like IPL for rejuvenation. And speaking about acne scars, I really love to use the CO2 to sculpt the shoulders of each scar. So I start with microneedling radiofrequency to have more collagen production at the base of each scar, and then after I concluded all sessions with microneedling radiofrequency, I really love to use the CO2 to sculpt the skin and to make it more flat. I started to use microneedling radiofrequency years ago. If I have to think about an advantage compared to other devices, is the no downtime effect we have. So the patients are really able to go back to their normal life extremely quickly, the same day of the procedure. So we are not affecting their life, we are only improving their life. When the device arrived in my office, I spoke about the device to my wife. And the day after, my wife was in my office to try to use it. She was very happy, and this was not lucky for me because a lot of her friends came to my office to do the procedure. I strongly recommend this device to my colleagues. The versatility of the device is another important, is a key point for me, and your staff can use it for other indications. You can define it as a very effective one with minimal to no downtime, and is at the end considered as a making money machine.